I'm Nick Harper, your state senator from the 38th Legislative District. 2 days have passed since the Senate voted to pass its bipartisan budget plan. I was one of the 34 yes votes, but that doesn't mean I didn't cast my vote without serious concerns. We made drastic cuts to the basic health plan, children's health, our disability lifeline, the temporary assistance for needy families, education, and many other essential public services and programs. Unfortunately, cuts are the only option available when trying to solve a $5.1 billion budget gap without the ability to generate new revenue through either tax reform or the reduction or elimination of tax preferences. My biggest concern is that we're solving short-term problems while creating longer-term ones. Cuts to programs now will lead to greater costs in the future. The only question for us is how much will it cost us down the road? That's why I sponsored Senate Bill 5872. It's easy to see how much money we can save by taking a little from here or cutting a little from there. The problem is we don't have an accurate way to measure what taking from here or cutting from there will cost us down the road. The idea behind my bill is to provide lawmakers with a method to see the long-term effects of our short-term decisions. Under this bill, the Office of Financial Management would establish a procedure for producing fiscal notes, the statements that tell us what legislation costs, that reflect the expected impact of budget cuts. Let me give you an example. The Senate budget plan cuts approximately 8,000 people from the state's basic health plan. We know how much money that will save us this biennium, but what will it cost us in future biennia? This bill will factor in what it will cost the state in the long term when 8,000 fewer people have access to health care. Just because they are being denied this service in the next 2 years doesn't mean they won't receive care. Without health care coverage, we can expect people to make additional trips to the emergency room. When people who can't afford it use the emergency room for basic health care needs, hospitals are forced to raise their rates to make up the costs. That's just one of the impacts of a lack of health care coverage. This will provide us with a mechanism to consider many more. When this bill had a hearing last month, advocates for senior citizens, health care, education, family planning, and labor groups, more than 40 in all, showed up to testify on its behalf. The fact of the matter is, everything in this state budget is connected. When we squeeze from one program, it usually means ballooning costs to another. This bill will make those costs clear so people and lawmakers alike can see the real consequences of an all-cuts budget. It's about transparency, but it's also about responsibility. Please let me know what you think. Don't hesitate to email, call, or drop by my office with any questions, comments, or concerns. And thank you as always for listening.